Good afternoon, Dr. Kosala. How are you? Haven't had a chat for some time.
Yes, good afternoon, sir.
So how is this appointment?
Yes, I feel it's a good appointment. So I have been doing this appointment for 6 months, and yeah, I learned a lot of things, especially when it comes to the clinicals. Yes, thank you.
So now part of this process is that I need to mold you into becoming a consultant,
Okay.
and I need to give you feedback on specific issues.
Okay.
Now it has it has come to my notice. People have told me that there's a problem regarding your punctuality.
But I usually comes time.
Now
Sir.
even today for my appointment at 8, you not make it till 9. So what is your experience? Tell me your side of the story.
So sometimes I have work in some other places, not only in the ward, as I have to run to the clinic, and sometimes I have to see the patients in the other wards as well. So that's why sometimes I run out of the time and become late.
So do you see there is an issue in this, or do you think there is no?
I feel that I'm coming at time.
Okay, but if there are many people are saying this to you, you may have there may be some truth in it, and because it just happened now as well. So is there any way we could remedify this?
Yes, I'll try to adjust to the time and be punctual. When I do my next appointment.
But what are the strategies you would use to make sure that you will be on time?
Yeah, I think if I have a timetable and if I adhere to the timetable, and reminders may remind me to start at the correct time.
Does it mean only your work in the hospital?
Not only the work in the hospital, so I have to balance my life between work, my studies, training, and my
family
life
as well.
Yes, I accept that. Yes.
So I think we all have been registrars, and we have always had time constraints because we are divided between family, studies and work. But because there are people telling, and in my experience as well, that even for this feedback you were late, I feel that it is a area which is important and also can be corrected.
Okay.
So how do you feel about it?
Yeah. So I think as a trainee, and especially when I become a consultant, so I have to be punctual and I have to be an example to the others. So I think it's a good point to make it in the training, during the training time. Yes.
Okay, thank you very much, Dr. Kosal. I wish you all the best, and hope that your rescheduling will make you more and on time.
Thank you, sir. Thank you.
In giving feedbacks. Now, what I did with Dr. Kosala is I first let him think about his problem. Initially, he didn't even think that he had a problem, but of course, I asked him time to ventilate with my multi-resource feedbacks and also this personal experience, which make this issue most accurate. And with that, we discussed regarding the problem, and then he came up with his own strategies like timetabling, prioritizing, and so on. And then we closed this by coming to a conclusion. Now here I did not concentrate on his clinical abilities or any other regard. This feedback was specifically identified on punctuality. So when you're giving feedbacks, you identify one of few and make sure you are correct that there is a deficit, and then you let the trainee come out with their side of the problem, and then together you come up to a solution. Things you do not do is you do not start by giving negative reports, negative comments like, Dr. Kosala, everyone says that you are getting late. Why is that? Even today you are late for this appointment. You're always late. Now, when you say that type of comments, you start with negatives. And also when you say all is always late, that's most probably false. So therefore, you need to get the trainee engaged in the discussion. Even the trainee does not realize that there is an issue. And then from there you build the feedback.